My name is Paul Chapman. I am a physiotherapist by background, but what we want to do today is give you an oversight into the world of podiatry. Now, as I say, this event is aimed at the armed forces community, and what you will see today is there are individuals who have moved from an armed forces career into that of podiatry, and what I hope to do is give you the breadth of and the width of professions that are available within the area of podiatry. The event will give an insight to what podiatry is. It will talk about how to become a podiatrist, and we have colleagues from the universities on the call, so if you wish to discuss with them about how you would navigate that, then you can engage with them a bit later. What we will also be doing is hearing from podiatrists, those podiatrists who had an armed forces career. And what we want to do for you is to give you an insight, an overview of how they became a podiatrist after serving within the armed forces. Next slide, please. So, why are we asking you to look at podiatry as a career? Well, podiatry is a brilliant career opportunity for anybody who is interested in joining the healthcare setting. Now, I am a physiotherapist and I've worked very closely with podiatrists, and you understand that the work that they do is vital in the support of lower limb integrity, biomechanics, etc. I'm not here to talk about podiatry because I'm not a podiatrist, but what I would do is I am here to talk about why we consider you within the armed forces are ideal individuals to look at as a career of podiatry. We know there's a lot of evidence out there that individuals from the armed forces do pick up health careers, and podiatry is one of those. And as you can see, there's a little poster there of a podiatrist, and that is an individual who has done a career change. Now, they haven't career changed from the armed forces, but what they've career changed from is somewhere else and taken podiatry as the future career they want to move forward. Now, you may be at the point where you may be considering leaving the armed forces and looking at it as an alternative career. What we will do today is we will talk about those transferable skills. We'll talk about why people pick up a career in health, but also why those individuals want to work in that setting, what they're able to give, and the opportunities that are available for you. Next slide, please. Okay, so let me just talk about a group of individuals, and podiatry is part of that cohort of individuals. Now, if you become a podiatrist, you will join a group of individuals, a community called Allied Health Professions. Allied Health Professions are made up of 14 individual professions. Within the NHS, there's around about 350 careers, and AHPs are 14 of those careers that are available for you. Now, if you really want to be picky, you could say there's 15 because radiography is split into diagnostic and therapeutic. Allied health professionals, and this applies to podiatrists, you're registered practitioners, and you have to be registered to be able to practice and use the protected title of that of podiatry. There's also, and they are registered with the Healthcare Professions Council and the General Council of Osteopathy. Being an AHP, and that particularly as of a podiatrist, means that you're an autonomous practitioner, which means that you can work on your own, you can work in isolation, but you can actually work in a number of sectors, both the private and the public. Within the NHS, the allied health professions combined make up the third largest workforce behind doctors and nurses. So what's unique about being an allied health profession, or in this case, particularly a podiatrist? It means that you can assess, diagnose, treat and discharge patients. You're not dependent on other people doing that for you. You can make these clinical decisions. That's why you're autonomous practitioners. It's possible, and this applies to podiatry, to manage a patient's care from birth to end of life. And hopefully you'll see that later when we meet some of the podiatrists we've got lined up for you. The aim of any allied health professional, particularly a podiatrist, is to maximize the potential of any individual's life, to allow them to live life to full and live activities to allow them to achieve that. Within the sector of AHP, there's many professions, the 14 I talked about, but also it's broken down. I'm going to learn about that with podiatry later. There's many sectors within the podiatry environment. It's very similar to that within the armed forces. You could work both as a clinician and a non-clinician in the world of podiatry, and you're going to learn about those individuals, and we're going to meet some individuals from the universities who are podiatrists, from academia, from the clinical, and from leadership as well. Within our AHP world, they're also supported by non-registered clinicians. So if you don't want to go down the registered route and qualify as an AHP or a podiatrist, it is possible to be the support mechanism within that and be a support worker. Next slide, please. So this is the 14 professions, and they're all flashing up in front of you, and they vary from that of art therapists all the way through to the technical end of diagnostic, therapeutic radiographer and ODP. As I say, there's 14 of us in total: physios, dietitians, operating department practitioners, orthoptists. There's music therapists, art therapists and drama therapists, occupational therapists, and there's also paramedics. But more importantly, we're here to talk today about our podiatrists. And he is the little guy there in the green with a stethoscope around his neck, holding a Doppler, which is a machine which is used by podiatrists going forward in the treatment of patients with lower limb issues. Next slide, please. So as I said, the allied health professions is a group of individuals very similar to that within the armed forces. And what you have within your armed forces is you have your army, your navy, your Royal Air Force, Marines, etc. Similar applies within the allied health profession. So you'll be an allied health professional overall, but you may be within a specialist profession. And for example, on the slide here is dietetics, but what we're going to talk about today is podiatry. And you then may be a specialist within that area, and similar to that within the British Army, you might be within the regiment of the Royal Engineers. Next slide, please. So what we're going to learn about today is why you could become an AHP or a podiatrist. And as you see from this slide here, there's many skills that you already have that you are using. I'm going to learn about those later from colleagues who are going to be able to tell you what skills they brought from the armed forces into that of a career of podiatry or as an AHP. But as you'll probably see, you've already got your command, your leadership and your management and your team working skills, which are very transferable and used by our AHP colleagues within the sector in whichever they work. Next slide, please. Okay, so that's me and just giving you an overview of what it's like to be an allied health professional. What we're going to do now is we're going to hear from one of our colleagues, one of our podiatry colleagues who is a member of the Royal College of Podiatry, and Emma is going to talk to you about what it is to be a podiatrist. So over to you, Martin. Thank you.
Hi and welcome to the Podiatry Insights Day. My name's Emma McConaughey and I'm a podiatrist. I also work here in the Royal College of Podiatry in the Press and Communications team. Now I'm sorry I can't be with you live today. I'm actually in clinic and I did have to put my patients first. We're very busy in clinic at the moment and had to prioritise their healthcare. So I do hope you'll forgive me for doing a pre-recorded message. So first of all, congratulations on coming along to the webinar and taking the first step in potentially your new career. I started my training 25 years ago and I have never once regretted my choice to go into podiatry. I actually wanted to be an optician, didn't get in, best thing that ever happened to me. So you might be thinking, what is a podiatrist? Now hopefully you've heard of us before or you know a little bit about it, but in very simple terms, a podiatrist is an expert of the foot and lower limb, like a dentist is of the mouth or an optician of the eyes. We have a huge scope of practice, so whether we're in NHS, private, independent, working in a sports team, in the Ministry of Defence, in a prison, on a cruise ship touring the world, any of the number of numerous places that podiatrists work, we have quite a large scope. So we will basically deal with any issue in the foot and lower limb. Now you might associate us with, who I go to for my verrucas or my ingrown toenail. And yes, we do all of these things, But we also do so much more. So just like the dentist maybe does the checkup on your teeth, but they can also do your complex surgery and diagnose all of your different issues in your mouth. We can do the same for the foot and lower limb. So we'll see patients who have everything from foot pain to maybe joint problems. They might have concerns about their foot health. They might have a wound that needs treated. They might have a sports injury. They might need minor surgery on their feet. The possibilities really are endless, because at the end of the day, most of the population's got feet and they only get one pair of them, so they're probably going to have problems at some point. Now, one of the big ones that you've probably seen in the press is things like diabetes and how that affects the feet. Well, globally, we do have 1 foot lost to diabetes every 20 seconds, and here in the UK, it's roughly 200 per week. Now, as podiatrists, we work very hard to prevent that from happening. We work towards early interventions to try and save those limbs, because sadly, the chances of a survival with a non-trauma based limb loss, where it's something like a disease through heart problems or diabetes, the statistics aren't great at 5 years, and we really are about improving people's quality of life. So we will treat people from cradle to grave. So you can be seen by podiatrists at any age. We see children, paediatric podiatry, and that might be for developmental issues or foot problems that might come up. We see them right through to end of life and palliative care as well, and everything in between. So chances are probably one of you has had a foot problem at some point in your life anyway. You've maybe even seen a podiatrist for one, which is a great way to learn a bit more about the career. But today you're going to hear from a huge range of people, many of them ex-forces personnel themselves, on why they chose podiatry and what they found that it offers their life. For me, I've been 25 years since I started my training, and for the past 20 years I have run my own business. I now employ a staff of 12 in central Scotland, and it's given me the flexibility to choose the lifestyle that I want. I work in clinical practice a few days a week, and I work for the Royal College of Podiatry the other days. And I have a young child as well who has disabilities, so I have been able to set my lifestyle to the way that I need, and it's provided a great amount of flexibility for me, as well as, most importantly, job satisfaction. I enjoy every day at my work. I might have 14 patients in a day who could all come in with the same problem, but they're all attached to different people, and the connection that I've been able to have with my patients over the year, it's second to none. I've been very, very fortunate that I've seen some patients for 21 years, and to be able to be part of somebody's life and their healthcare journey for that long has been an absolute privilege, and one that I hope to be able to continue for quite some time. So, please do listen to all the lectures today, listen to the scope of what's there, and I really do hope that you consider podiatry as the next step in your journey. And there is jobs out there, tons of jobs. I have many jobs here in Stirling if anybody ever wants to come up. But yeah, you're pretty much guaranteed a job when you leave university. The student I've got here, she's in her final year. I offered her a job on week 2 of her course. So you shouldn't have any problem finding a new post once you've qualified. So best of luck, enjoy the day, and hopefully 1 or 2 of you I might meet as qualified podiatrists in the next few years.